Hi, everyone. Welcome to the NMQF Friday webinar. Thank you for taking time on this lovely August Friday afternoon. I know many of you are vacationing or getting those back to school things, so we really, really appreciate you being here. So I'm going to just start us. I know we'll have more folks coming in. So let me set this up. And I'm going to start the slideshow. Can everyone see my slides? I will guess that you do.
We can, yes.
All right. So again, I want to thank everyone for joining us today on what I think is a hugely important topic, making sense of the vaccine environment, especially what it means for people of color and what we can do. We have three amazing experts helping to think through this. You have this information from your registration, and we will share the slides as well. So I'm not going to read their resumes because they're all enormously accomplished and truly dedicated public health leaders. First, we are very lucky to have Dr. L.J. Tan here, and you see his title. He has been involved with and deeply knowledgeable about vaccine policy. Long time going on now, and thank goodness you're so active now, LJ. We also have Dr. Daphne Ferdinand, who is the executive director of the Healthy Heart Community Prevention Project in New Orleans. She too is extremely accomplished and almost single-handedly, I know with many partners, has doubled the flu vaccination rates in the Ninth Ward in New Orleans over the last few years, among other things. I am always amazed and impressed with Dr. Donnie John, who is the executive director of NovaScript Central. He is indefatigable and works tirelessly and creatively to promote health and vaccination, not just in Northern Virginia through his organization, but much more broadly. So thank you, panelists. I just did a little Googling. I didn't use AI. I guess I could have to see what's been in the headlines about vaccines in the last 3 weeks. And this is my little uh, picture show of the issues that are just racking the conversation in vaccinations. I'm not going to speak to all of these because I think everyone on this call has a good sense of what we've been facing. So I'm just going to give you a little background information and then go right to the panel. I do hope that you'll look for, beginning in September, our monthly trusted vaccine updates for your community. We're working with some great experts to kind of filter, review, highlight, designate things you can trust, especially as it applies to people of color in the community. We have a number of programs and materials related to vaccine understanding and vaccinations, and we will be making that possible. I ask you to go to our homepage, shcnmqf.org, and learn about our programs and join us. Here's some of our programs: our faith-based network, Faith Health Alliance, our community pharmacist ambassadors, our clinical tool, the Drive Toolkit, and our Health Champions program. I would be remiss if I didn't bring up the fact that Dr. Gary Pupkin, who is the head of and founder of National Minority Quality Forum, has launched a really innovative approach to thinking about how to really measure and press for evidence-based, community-engaged health and healthcare based on what are the factors in the whole universe that are needed to be abided by if we are going to conserve high quality long lives. And you see, I have a URL here that you can go to. There's a series in Health Affairs, and including the most recent one related to meningococcal vaccination. So I ask you to put your questions and comments in the Q&A box, not the chat box, and we will get to answer everyone. Maybe we won't get it all answered during this hour, but an answer will be given to all, and it's being recorded, and this will be available to you. So thanks again, and why don't we go ahead and begin? I have a launching question that I've asked our panelists to think about. First, it's what's happening with ACIP, and maybe LJ, you can explain what ACIP stands for, because I know a lot of people, it's been fairly obscure, but maybe you can describe the role of ACIP and what's happening to it now and what the implications are. So LJ, would you lead us by describing that? You're on mute, LJ.
Thank you very much, Lauralee, and thank you for inviting me to be part of this really fantastic panel. I appreciate being here. And I'm standing in for someone who's wonderful. So Yabo, if you're watching, hang in there. That being said, the ACIP stands for the Advisory Committee for Immunization Practices. This is a long-standing committee that it's a federal advisory that's governed by FACA, which is Federal Advisory Committee laws. It advises the CDC director. So in other words, the ACIP provides recommendations to the CDC director, who then adopts them, and they become national public health recommendations for practice. The ACIP was always an evidence-based, rigorous, science-based committee that did a lot of the work was done by the Centers for Disease Control, the CDC. The CDC staff would do this very rigid grade-adopted evidence review system. They call it the evidence to recommendation framework. And using the evidence to recommendation framework, the ACIP would come up with recommendations for public health use of vaccines. It was such a well-run, rigorous body of experts with no conflicts of interest, looking at, and when there was declaration of conflicts of interest, and of course recusal from voting. But that entire process is very well done through it was very well done through for the ACIP, and they would then make recommendations, and those recommendations be adopted by legislator, by policy, and of course by healthcare providers as well. Until recently, there has never been any reason to have challenged the Advisory Committee on Immunization Practices. They were just that solid. I mean, there was solid science-based evidence. And as a result, they became the linchpin for a lot of our current work, because we never thought that what has happened now, Lauralee, as you suggested, would happen. And what has happened is that the ACIP has been changed. And it has been changed first with the removal of its original 17 members who were experts in multiple disciplines of vaccinology, evidence-based decision-making, vaccine safety, clinical trials, so on and so forth. So everything that's required to become an expert in vaccine recommendations, these 17 people they were removed, and they were replaced by individuals, who are now currently part of the new Advisory Committee on Immunization Practices. And they had their first meeting last June, excuse me. And, unfortunately, it is concerning. Some of the observations that have come up publicly, and they reflect some of my own personal feelings as well, have been challenging. There was a clear loss of the respect for the evidence, and a clear loss of the way evidence was used in decision making. So, for example, the one I would like to point out very clearly is that there is a lot of evidence that suggests that thimerosal, which is a preservative containing ethyl mercury, has no relationship to vaccine safety. The multiple publications have shown that. And in fact, there was initially a CDC document, evidence document that was posted online that kind of summarized the evidence, saying that there was no evidence of harm. That document was removed, and we had a vote from this advisory committee of immunization practices that removed thimerosal from multi-dose vials of flu vaccine that was not evidence-based. And so that may be the harbinger of things to come. I certainly hope not, but the loss of evidence-based decision-making at the advisory committee of immunization practice is concerning. I think that's a very broad level statement. There are obviously individual ramifications from that because of the fact that so much of what we have done referred to the ACIP. And so, now we have to start rethinking what, if the ACIP is no longer making evidence-based choices, where do we come in, right? And so I'm going to just pause there and hear what other folks have to say. It is extremely concerning, Laura Lee.
Sorry, I was on mute. Donnie or Daphne, do you have any comments relevant to the changes in ACIP and any concerns that raises for you? And you're both on mute.
Well, my biggest concern, Laura, especially dealing with the community, where will the community get the information? Evidently, there's a lack of transparency here in that decisions are being made by politics and not by science. So there's the transparency is of concern. How will individuals, how will patients, how will community members know what to make, what kind of decisions will they be able to make with regards to protecting themselves and their family members? So that is something that I am very, very concerned with, as well as the at-risk communities and under-resourced communities who are dealing with various comorbidities. And then we don't have the public information that is provided to the community. And for instance, like with our state, they have already decided that there will no longer be any public communication regarding vaccines. And we are devastated as a result of that because of the communities that we're working with.
Thank you, Daphne. Donnie, do you have just anything to add to this issue?
Yeah, I would echo what Dr. Fernand said, that where do we send people to look for information? We tell people don't use Dr. Google, don't go to ChatGPT to find your answers. So historically, we have spent a lot of time and effort to get people to go to trusted sites that are CDC, HHS, government websites, or reputable sites this is where you can find credible information and validate this content. But now when you go to these sites, the information that you find is not necessarily reputable. You can verify it. Sometimes it's hard to find the information, as LJ pointed out, that used to be there, but it's no longer visible. So in this information gathering era where we are looking to find information and everybody's Googling or now using ChatGPT as their mini doctor in their pocket, it's scary to know that people don't know where to turn to. And it allows people to have more influence where, a lot of people go on TikTok to find information. So if I'm pointing at my screen or pointing up in the arrows, that's what's going to convince somebody to listen to my recommendation over someone else. And there's not a lot of credibility. So we spend all this time to improve health literacy by knowing where to look for information, how to assess this information. And now we're going backwards. How do we look at, regaining trust when people are legitimately skeptical of things? And also from a liability standpoint, as a clinician, what's the liability if someone chooses to follow a recommendation that's not the norm? But they say, well, the CDC said this or so-and-so else said this, but then you're using your clinical judgment and your years of experience to look at what's the best treatment plan for my individual patient in front of me. That's the other scary part as healthcare professionals that we really have to think about, is just the legal liability when it comes to malpractice. When people do something that's not based off sound medicine or medical practice, who's at fault? You can't sue AI, you can't sue Google for giving you the wrong information, but if it's federal agencies providing inaccurate information that leads to harm, that's a gray area that we haven't really discussed how to handle, or navigate.
Wow. I wonder, Donnie, also, the ACIP recommendations historically have been important for pharmacists in their ability to vaccinate in many states. Can you comment about that?
Yes, so pharmacists are the most accessible healthcare provider in the country, and they have been a huge crusader in terms of vaccinating half of the Americans for COVID-19 flu for many years now. So now the ACIP guidelines were the bedrock of how pharmacists were looking at, based on state law, because every state allows different practices of how young of a patient a pharmacist could immunize. They use this national framework as here's the best practice, and this is why pharmacists should vaccinate children under the age of this age, or here's the vaccines that are most appropriate. So with that having concrete information that you could reference from ACIP, it really impacts scope of practice. Can you now look at the AAP guidelines or other validated guidelines as how you make the state regulations more relevant? And if some states, as Dr. Ferdinand mentioned, if you can't even advocate for vaccinations, that's going to change, who's able to administer vaccines, where vaccines are given. There's a lot of infrastructure things that, come into play that is very concerning as well.
And won't we see, and I see LJ, you turned on, but so maybe you could be the first to answer this. Haven't the ACIP guidelines also informed insurance coverage for vaccination, including our federal and state health insurance programs? And is there some concern about this?
Yeah, I think again, this harkens back to what we've been all talking about, is that so much of what we've been basing our vaccination policies on have been, pinned to the ACIP because they were this rigorous evidence-based expert panel, right? And in fact, as you suggested, Laurelie, a lot of our insurance coverage policies are indeed pinned to the ACIP as well. But all that being said, I want to remind people is that the way they're pinned to the ACIP is that the ACIP sets the bottom standard of what you're supposed to cover or what they recommend coverage on, right? So it's the bottom, it's the floor. So if the ACIP drops the floor, there's nothing to say we've got to follow them down that floor, right? We can keep where we are, or we can cover better, right? It's the minimum coverage, minimum standard is what the ACIP sets. So if we want to do better, if ACIP drops their standards because they're no longer evidence-based, I urge ourselves to be better and do better, and that is we stand by the evidence and we cover, and this is my urging to payers, is that payers should cover based on the best available science. And I think with immunizations especially, the best available science is very clear.
I thank you. I think everybody can see why you're such a great advocate, because you hearken to a positive message here about what we can do. We can do better. But aren't we facing cuts in Medicaid programs in the upcoming year and a half? And won't that have an impact on vaccine access? Anybody?
Definitely, because a lot of times, when you have insurance, most vaccines are covered, as LJ mentioned. But for the millions of Americans that are uninsured, that have historically have no way of paying for vaccines, they've had to find different avenues. Sometimes there are programs, whether it's through a local pharmacy or national pharmacy chain, or through the manufacturers, they might have programs that offset the cost of a flu shot or a COVID-19 vaccine. We have COVID-19 vaccine funded by the federal government for a long period of time. And so with millions of more Americans expected to become uninsured, it is concerning as to, can they afford the cost of a flu shot or the cost of things like Zostavax that are a little bit more expensive, that's geared towards more of your Medicare eligible patient demographics. So it is a concern of, it's always been a concern, quite frankly, of we could educate people to go get vaccinated, but then we don't always focus on how do they pay for it. And sometimes when we have insurance, we choose insurance plans that may not cover everything at the 100%. So the out-of-pocket copays might be a cost prohibitive for people to get vaccinated. So there is an active effort, amongst different groups to really find innovative ways of offsetting cost, through patient assistance, whether it's directly from the manufacturers of the vaccines, if there's state-specific funds that can offset the cost, looking through their local health departments to help modify it. And I just want to add one thing to what LJ was mentioning of how the ACIP is the floor and insurance, and he encourages insurance companies to do to do more to cover like above that, you have claims data. You have the evidence of not only the science behind the safety of vaccines, but also you have millions of claims data that shows how vaccinations prevent illness or prevents complications. At the same time, the cost of illness and the rate of illness depending on the zip code you live in. So insurance companies know well in advance from their actuarials what the true cost of care is. So it's a proactive approach that is built off of what the Affordable Care Act was. How do we focus on preventative interventions versus reactive interventions?
I thank you. So both of you kind of started mentioning a couple of specific vaccines, and I want to kind of probe. And so what's different about getting a flu vaccine this fall, given the current circumstances and in terms recommendations and coverage and access? Any change?
I'll jump in right away. So to our relief, the ACIP did vote that they are maintaining the current flu immunization recommendation for 6 months and above. The only thing that they did, which I mentioned earlier, was they took thimerosal out of the flu vaccines, essentially saying that they're no longer allowed, and so they're no longer recommended. And so thimerosal is in about 4% of our flu vaccines through multi-dose vials. And the different manufacturers have approached this issue differently, but the recommendation to vaccinate still remains 6 months of age and older. And I know Dr. Ferdinand's here and Dr. John can talk to all the reasons why. That's great news, because their populations are incredibly vulnerable to influenza complications and need to be protected against flu.
Any other thoughts about what I heard LJ say, that everything's green light go for flu vaccination this fall?
It's great news for us, since we have been engaged in multiple campaigns annually for the past 3 years here in New Orleans to promote flu vaccines by running a Flu Ready NOLA campaign. And this is a mass educational campaign where we've hired a PR firm to help us to get the word out, and so that we can keep those vaccine rates up. So we're glad that we can still move forward with our campaign, with educating people and improving public health in our city.
Thank you. Donnie, anything to add about flu?
No, I echo the sentiments that the other panelists have mentioned, and it's just, I think the key message is that just because you get the flu shot doesn't mean you can't get the flu, because I think that's the biggest thing that people argue of why they're not going to get the flu vaccine. So just the relationship between the individual person and their medical provider or the healthcare professionals they come across, building that trust one person at a time, knowing that vaccines aren't cures, they help minimize the severity of the illness. And as LJ and Dr. Fernand mentioned, there are so many complications that can arise from a lot of these things that are vaccine preventable, minimizing the severity that decreases your long-term risk. So once again, we have to really focus on that safety and look at setting realistic expectations that just because you get the flu shot, yes, you might get the flu, but you may have the flu symptoms for a shorter period of time compared to not having the vaccine and might experience it for a week or longer.
Right. And result in hospitalization, which we know is higher
Yes.
in Black Americans from the flu.
Exactly. And elderly. Older minority
people.
populations as well, Lauralee. And one of the things I always say to folks over 65, is this idea that influenza, if you catch it without being vaccinated, you can walk into the hospital with influenza, but you may come out with a walker, because 3 weeks later you've been hospitalized, you've got it just takes away your quality of life. And I think that's something that we've got to continue to emphasize to especially our elderly population, that you want to maintain that quality of life. And if you're eating healthily, if you're not smoking, if you're watching your weight, if you're doing your steps every day, influenza immunization is one more thing you add to that arsenal to maintain your quality of life.
Yeah, and a big overlap of that of people with a lot of chronic conditions who are more vulnerable to more untoward outcomes with flu. So let's go.
Dr. Ferdinand's here, and Lauralee, that people with heart conditions, cardiovascular conditions, that's a huge thing. Data is very clear now.
Exactly. And we try to focus on that in New Orleans whenever we conduct our campaigns with regards to the target audience that we're trying to reach, especially since we're focused on cardiovascular disease prevention. And we know when those patients receive that flu shot, that they're less likely, if they did contract the flu, because just like Dr. John said, it doesn't protect you from actually becoming infected with the virus itself, but it can also reduce your possibility for hospitalizations and also becoming very, very sick.
Right. And I know my ex-husband, when he got the flu a few years ago, he was stunned at how sick he got. I mean, people don't really always appreciate how serious the flu can be. But let's go on to another disease. What's happening with COVID vaccines now?
Meaning, ACIP is got to make a recommendation, and really, anything goes with this current ACIP with regards to the COVID-19 recommendation. I will point out that the American Academy of Pediatrics, and I think Dr. John, you've mentioned them already, issued on Monday their pediatric schedule, and in their pediatric schedule, they recommend COVID vaccination for up to 2 years of age, and then for 2 to 4, I believe, for high risk, and then 2 to 18 with high risk, they recommend vaccination. And then they also say that you can for kids who are not at high risk, they should be offered the vaccine. So it's kind of like a risk-based strategy for kids over the age of 2. Now, I would urge people to go look directly at those recommendations because I'm just coming from memory. I don't want to misquote anybody. But I think the point here is thank you, Dr. John. He's got it in the chat there for everyone. So maybe we can put that for everybody. But I think the bigger point here is that we got to go to some of our trusted, provider organizations to take a look at what recommendations are going to come out with COVID. We do know that ACOG is about to issue something. The American College of Physicians is about to issue something for healthy adults, and we also know that the American IDSA is going to probably issue something for immunocompromised adults coming forward. I think the biggest problem with COVID is that it was already a vaccine that was sitting underneath I would argue, an unjustified stigma, a politicized stigma, and what's happening with the ACIP recommendations is that it increases provider confusion because of the different populations that we have to look for. And again, the vaccines are also going to receive different indications from what I understand today as well. So some vaccines may lose their ability to be used in kids and so on and so forth. But what this general environment does is create additional confusion. And when there's additional confusion, the first thing that suffers, as we all know, is access. And that's our populations, right? These are the populations we care about. The minority population, the BIPOC populations, they're the first they're going to feel the impact of lack of access or changes in access.
Right, and confidence.
Yeah.
And, we already, as you mentioned, had an issue around COVID vaccination. And I'm gathering that the new COVID vaccine for this year will be coming out in September, is what I've read. Is that true?
The vaccines are essentially ready to go. We are waiting on the ACIP to issue some form of recommendation. My hope is that manufacturers will also start thinking that as we're suggesting, maybe it's time to look to a provider organization. Maybe it's time. Maybe when these organizations issue their recommendations, as AAP has already done, maybe the manufacturers should time their release of vaccine supplies with those recommendations, right? I think we need to think about how we're going to address this on a holistic scale now.
Right, and optimize it. What about vaccines for children and measles vaccines in general? We've seen a lot of concern about that in this last year with a lot of outbreak. Anything going to change in terms of the vaccine for children program or access to childhood vaccines in general? And I know we don't have our pediatrician, Dr. Yabo, here to help us, but maybe one of you know something about what's happening in the kids' space?
I can jump right in with a little bit of a higher level because obviously it's a bit of the policy work that I also do. But what we're understanding right now is VFC will continue to cover COVID vaccines. That's not going to change. And I think on a bigger level, vaccines for children is tied obviously to ACIP approval, right? So when the ACIP makes a vote for a recommendation, they also vote into the VFC. The two are intricately linked. So right now, because the ACIP, as of right now, with influenza, for example, VFC is fine because they voted in 6 and older, we're good, right? The question will now come in September, what changes are made to by the ACIP? And then at that point in time, we'll have to see what happens with the VFC coverage for COVID vaccines.
I'm just looking at my notes. So any other vaccines that you're keeping your eye on in terms of impact of this environment we find ourselves in? Somebody mentioned the shingles vaccine earlier, et cetera, which are, maybe more expensive. So lack of coverage could maybe be a big problem.
Yeah. So Laura, I just want to go back to the COVID-19 vaccine. One of the challenges that we're going to face with COVID-19 vaccine is we never really fully understood the issue of long COVID, people that had COVID and had complications from the disease.
Thank you.
And so when people have experienced COVID, even after getting vaccinated, the question becomes, did the vaccine cause me to have these symptoms, these lingering effects, or was it COVID-19 itself? And that confusion as to, what was the cause of me having, brain fog or cardiac vascular issues, it's, the information out there is cloudy, right? So people don't know what to trust. So already before we have the new recommendations coming out, people are skeptical of the COVID-19 vaccine because they don't know, was it the vaccine that's causing me to have cardiovascular issues, brain fog, or other complications associated with long COVID, or was it the illness? And it's easier to push, look at, well, I got vaccinated and then this happened, not understanding that COVID was an evolving thing, that what we knew of how COVID impacted our body wasn't sufficient at that time, and science is always evolving. So one of the challenges, regardless of what the recommendation comes out, is how do we really address people's concerns as to, well, last time I got the vaccine, I had this, I had right arm pain, or I had something that went bad that I don't want to experience again. So we have to do a lot to really educate people about the safety and understanding their concerns. Really, for clinicians, we have to know what is the true impact of long COVID. So those with cardiovascular disease or those with more severe complications, how do we address those issues head on? We do have, across the country, we have a lot of hospital systems that created long COVID clinics, really looking at treating people that have been impacted by COVID. And it's important for us to learn from what their practice models have been in terms of how they've been able to help people recover, to really help offset the concerns the general public may have of, if I get the COVID-19 vaccine, is it going to cause me to have some complication? Because look at all these other people. So vaccine safety really requires us to increase the literacy of understanding the illness at hand. And when you talked about measles, the number of measles outbreaks, has skyrocketed across the country. I think we're at 3,000 reported cases, if not more. And that really comes from not knowing what's the long-term impact of measles. Because we live in an environment where we haven't had this type of exposure to measles or some of these diseases in a long time because people were vaccinated. So we don't know the journey of a child or individual that's been impacted by measles or polio and the complications. We tend to forget how bad the disease can be. There was a whole reason why we had the vaccines in the first place. So I think part of any advocacy campaign has to be really informing people, what's the impact of hepatitis? What's the impact of measles? What's the impact of polio in terms of safety of your long-term health outside of the vaccines?
Right. And whooping cough. I mean,
Yep.
I'm old enough to have seen pre-vaccine experiences and, kids my age who weren't vaccinated. Not trivial. So let's take it down.
Can I just jump in really fast with the whole idea of long COVID? There's
Please.
actually several meta-analyses out there now that show that the odds of long COVID are reduced in those people who actually have been vaccinated. So I think we need to do a better job, as Dr. John has suggested, of kind of reminding people the reality of the disease versus the reality of the vaccine and the vaccine risks. The whole idea of same thing that what the pediatricians had to do with obviously with myocardiopathy with COVID vaccine and young males as well.
Yeah, thank you for saying that, LJ. I appreciate it. Excuse me. Do you think the recent announcement of not funding mRNA vaccine research is going to kind of blend over to more more lack of trust in COVID vaccines? Are you worried about that? And even the development of new vaccines?
I'm happy to jump in and defer to Dr. Ferdinand and Dr. John for further comment. I mean, I think the biggest problem with that, obviously, is the government is a huge bully pulpit, and the secretary has been using that bully pulpit very effectively to undermine multiple levels of the immunization infrastructure. We haven't even talked about the vaccine injury compensation program issues that we're worried about, vaccines and autism report that's coming out soon. I mean, there's a lot of multiple hits that the secretary's targeting, right? But I think the idea here is this concept that I think with we have to be realizing that with some of the challenges. Oh, I'm sorry, Laura Lee, I lost my chain of thought. Can you put me back into the whole idea of what we're talking about again, Laura Lee?
I was just wondering about the impact of
Yes.
rescinding mRNA
Yes.
vaccine funding is
So
on.
that's just another attack on the whole infrastructure, right? And I think with the mRNA vaccine funding withdrawal that he did, the 500+ million, I think one of the things we want to keep in mind, excuse me, there's a truck going on outside. One of the things we want to keep in mind is that with mRNA, it's not just about vaccination. And
Right.
I think we forget the strength of the mRNA platform as a health technology, the advances with not just oncology, cancer, but with multiple other ways to work on things like autoimmune disease. And I think we need to reemphasize to everybody that mRNA technology is not brand new. It's been around for decades. COVID provided an opportunity of proof of concept, and boy, did it ever prove the concept, right? So now it is incumbent on us to take that and provide money for research and development so that we can take it to the next level where we can start curing cancer, we can start reducing autoimmune disease and all the other potential applications for the mRNA platform. So I'm just going to pause there.
I thank you for that. I want to kind of bring Dr. Ferdinand in to talk about, to begin the conversation about what's happening at state and local level, highlighting what's happening in Louisiana and in your city, both good and bad. If you wouldn't mind beginning this state and local conversation, Daphne.
Yes, I'll be glad to, but unfortunately, I'll start with the bad and I'll end with the good. And the
Okay.
good is going to be here in New Orleans, but I'll start with the state, the larger picture. You know, back in February in 2025, when a lot of this stuff was going, with all of these changes were being made, you know, with the Surgeon General of our state, he ordered that the state health department, which is, you know, absolutely unbelievable, to stop promoting mass vaccinations promotions. Okay, to stop the Surgeon General of the Louisiana State Department of Health decided to stop promoting mass vaccinations, including public health announcements, school campaigns, and the mobile vaccine clinics. And you know, a number of the FQHC clinics do have mobile vans, and they've
Right.
gone out into communities to do outreach, especially in rural areas where there are a number of barriers for transportation as well. So this has really set us back in a way in terms of policy across the state itself. And he was framing this as personal choice. But you know, there's consequences to this because, you know, without this public outreach, we have fewer people who get vaccinated. And
Right.
that's putting communities at risk for preventable diseases like flu, measles, and polio. You know, so this policy, this reversal in the original policy is keeping us on guard for the most part. And it signals the harm and the demands that needs immediate intervention. So, you know, the vaccines are the most effective tools in medicine. And we've already, you know, Dr. Tan and Dr. John have already alluded to, you know, the eradication of some of the viruses that have occurred, you know, throughout the decades. But, you know, vaccines only work when people get vaccinated and when they receive them. So in rural areas, many residents lack nearby health providers. and they do not know how and where to access these vaccines. And Louisiana ranks among the states in the United States with the lowest childhood vaccination rate. And that's why mass vaccine campaigns are essential, and we have done this in New Orleans, and I'll get to that a little later. So they bring the mass vaccine campaigns, bring the vaccines directly to the communities, and they help to reduce some of these barriers accessing care, especially for people who lack the transportation, like I mentioned before, who may not have consistent medical care, or they may not have the ability to take time off of work. So let's just look at about, the everyday working person and what they have to deal with. So to give you an example, during COVID pandemic in Louisiana, there were a number of mobile drives that where they administered over 90,000 doses of the vaccine, reaching underserved communities. So when you remove these barriers, you also improve vaccination rates and also reduce infections and disease. So we're very, very concerned about that. So Laura, would you like me to go directly into Louisiana and New Orleans and what we're doing here?
Sure, and then I'll invite your colleagues here to add any state and local comments, but why don't you tell us a good thing?
All right. The good thing is that New Orleans Health Department, which we have partnered with, decided to reject the state's policy. So they are going to promote massive vaccine educations. That's not going to stop them at all. So they have decided to embark on vaccine sites throughout the city. They're partnering with various organizations who are interested in joining arms with them in order to improve the public health of our city.
That's
So
amazing.
we are very, very happy to do that. We have a fantastic medical director for our city health department, who has embarked on our Flu Ready NOLA campaign, where we have been able to educate people through billboards, radio streaming, social media. We also have enlisted our trusted physicians who are members of the community and who are very vocal and present within the community, who have produced educational videos around the benefits of the flu vaccine. And I'm specifically talking about the flu vaccine is because we are promoting that every year, in the upcoming flu season. And we're very proud of this campaign and the number of people that we have been able to reach in evaluating the before campaign and the after campaign, in the thousands of people that have received an increase in vaccination rates in different areas of the state.
You don't want to mention your medical director of the City Department of Health? She is fantastic.
Oh, Dr. Avegno, she is wonderful, wonderful. In fact, we are partnering her again this year, where we are trying to develop town halls. She wrote an article in one of the local newspapers that she was engaged with a vaccine skeptic, and she decided that she was going to take this time to speak with this gentleman. And no matter how long it took, she stuck with it and evidently changed his mind, because now he decided that he was a believer. So she said if she could only have town halls with every individual person within our city, we would have a 100% vaccine rate with the flu vaccine. So what we're
great.
trying to do now is to conduct a town hall and enlisting various partners, our hospital partners, the city health department partners, and other organizational agencies to come together and bring out our medical school experts from infectious disease department to go around different parts of the city and hold educational sessions like a town hall, just to talk back and forth, question and answer, just to have a conversation and discussion so that we can get to the heart of the matter and try to lift this hesitancy and skepticism around vaccines.
You know, I thank you so much, Daphne. She is a fantastic public servant and advocate. And I see many of the names on our among our 10 attendees who all work with their city health departments. I see Bishop Carter in Baltimore. And you know, maybe we can get some information out to folks who are really vaccine champions on how they can work with their city health departments to promote awareness, confront misinformation, etc. I see you saying LJ.
Absolutely. I want to tell everyone who is online tonight, today, that partner, make your city health department your friend. They are wonderful. They are a tremendous resource to the community because they believe in protecting the health of the citizens of their city and of their municipality. So do partner and become their friend because they want to join arms with you as well.
To say, Laura Lee, if I can, based on what Dr. Ferdinand has just said, and obviously that incredible, that wonderful success story of that town hall is I think as we've talked about, and I think we mentioned this even when we were discussing this prior to starting this live conversation, the environment, as you've said, is changed, right? And so in the absence of that leading credible body right now, what we have to go back to are our providers and our community. And it is incumbent upon all of us who have the evidence, who are in the evidence-based medicine environment, who know the safety and who know the effectiveness of vaccines and who know the cost effectiveness of vaccines. It is incumbent on us to provide as much as we can to our providers so that they can have those town hall conversations that Dr. Ferdinand talked about with confidence, with assuredness that they have everything at their fingertips. We need to do that for them. So your resources are incredibly important, Laura Lee. And then more importantly, at the community level, right? In this environment of uncertainty, our patients are going to go to that community as well. So provider and community, we need to now figure out how to engage our community. Dr. Ferdinand, Dr. John, you guys have done incredible here. I mean, this idea of how do we give information to the pharmacists that are in the community, to the pastors, to the religious leaders in the community, to engage them so that access for the BIPOC populations don't suffer. I mean, that's the biggest problem, right? When we hear confusion and when we don't have community with resources, we don't have providers with education, they don't have another place to get information from. So I think we got to give that to our providers and to our community.
Amen to that, I will say. And let's show our support for the great public servants out there too, because they're probably not getting a lot of love email right now, huh? They're probably feeling some pain from their superiors and anti-vaxxer populations, etc. So maybe we can show some love to the public health servants out there, and including our CDC staff who've been so amazing over the years. So are you afraid that the disparities in vaccination rates are going to get worse? Racial disparities, socioeconomic disparities?
100%. So, one of the things that when we talk about the vaccine space right now, we also have to look at the rising rate of asthma and COPD within the country. And minority communities are historically disproportionately impacted by having higher rates of asthma and COPD. And according to the Asthma Allergy Network, 1 in 9 Americans die every day. Or it says 9. What was the exact fact? I don't want to mess this up. Their statement is that on average, 9 people in the U.S. die from asthma every day.
Oh my.
Which, imagine, vulnerable populations, that number is going to be even higher. So it's extremely important that we really connect with people to understand when you have comorbid conditions, as Dr. Ferdinand and LJ have been mentioning, you really need to kind of highlight why getting the vaccine is so crucial to your long-term health. Because if you have heart disease or pulmonary disease, these are things that getting sick can really exacerbate your conditions. And so the rates of asthma continuing to rise along with, COPD is really concerning because we have environmental factors that cause this, are causing this. We have a number of other things that might cause it as well. But people have to know that their overall health has to be addressed. At the same time, to something that LJ mentioned of providing resources to clinicians so they know how to have that honest conversation with their patients, to have it in a very respectful manner where people are very scared. And that's what we have to understand. Not everybody is looking to do the wrong thing. It's just they're concerned. And are we taking the time to hear their concerns? And how do we do that? And that really comes through public messaging. And I'll put some resources in the chat. The American Pharmacists Association has a great resource, vaccineconfident.pharmacist.com, which allows pharmacists to really look at the crux of what are concerns that community members may have and how can pharmacists proactively engage community members to build that trust, to reassure them on how to make sure that the vaccines are safe and appropriate, looking at the overall health condition for that individual. At the same time, I also put in the chat the Asthma and Allergy Network's statistics, because it is very glaring that if 9 people every day are dying of asthma, and when we go into the flu season, if people aren't going to get vaccinated and then they get hospitalized for flu and they have an underlying respiratory condition, their chances of survival, to what LJ mentioned earlier, you go into the hospital thinking one thing, but you come out in a walker. This is really scary and concerning because we have to address that concern, because this is something that, out of all the illnesses, if you can't breathe, you feel it, it. Right? So how do we contextualize so that people can understand that, this is really, so crucial and vital for your daily life that, who knows if today's your last day of being here because you didn't proactively approach your health.
I'm so glad you brought up lung disease because we're going to begin a program focused on COPD too in the Black community. But what I'm hearing you say, I'm going to boil it down. It's like 3 strikes, you're out. There are continuing disparities, racial and ethnic disparities in terms of vaccination. People of color have higher rates or more serious chronic conditions that put them at risk of poor outcomes from vaccine preventable disease. And it seems like health equity is a dirty word these days. So, I would like, Daphne, please.
Well, I agree with you and I agree with Dr. John. And you all already know, and your audience probably is well aware, it's also that there's data that shows that when public vaccine efforts drop, then vaccination drops and preventable illnesses increase, especially among Blacks, Hispanics, low-income folks, and uninsured groups. Okay, and we saw it after Katrina here in New Orleans. These similar gaps, when the healthcare system breaks, poor, minority, immigrant populations, non-English speaking communities, they lose access to essential care. It happened here after Katrina, revealing deep structural weaknesses that's in our healthcare system and how we support the most vulnerable people. So, we really should, take the risk of not repeating this failure.
Right. Thank you for that heartfelt extolling. How are we going to know? Are the data going to be collected on vaccination rates by population, by geography?
CDC has not. They're probably going to be changing some of their surveillance, but right now it's not been reported that they're stopping surveillance. That I think the surveys are continuing, but I think we do have, as Dr. John has pointed out, alternative methods to also monitor this. Claims data is can be used, as well as registry data at the state level as well. So I think we can continue to observe this, but I think it's going to get more challenging. Again, it's an overall, flood the zone, assault on the immunization infrastructure system in the United States. So I think we just have to be aware that this is going to be happening, and I think we need to be paying attention, especially to our people of color. I mean, I think this is going to be a challenge going forward.
So I
The
would
data.
extol everyone on this call and the people who received this video of this conversation to join us and, prioritize promoting public health through vaccines and health equity through vaccines. We're coming towards the end of our conversation. So we have a question here. Are there concerns that the PrEP Act will be reversed before 2029?
I'll take the first shot at that from the policy angle. I mean, the extension happened because of the fact that there's obviously a lot of liability coverage. It's also part of the PrEP Act for COVID-19 vaccines. And that's where a lot of the interest is right now. We're paying a lot of attention at that at the federal level. We're continuing to emphasize that there is reason to continue that. But you know what, Heather, anything goes right now. So it is very possible that it might be reversed before the 2029 deadline. So we'll pay attention and keep hoping that, we'll keep working to make sure it's not. In the meantime, we're obviously trying to work to transition COVID-19 vaccines out of the PrEP Act into the regular vaccine injury compensation program as well.
Thank you. We have another question about the interaction between environmental factors and the benefits of vaccine. So if you live in an environment that has a lot of pollution or other factors, how does that interface? Does anyone have any thoughts about that?
So recently, the NIH funding that's supposed to study the impact of environmental factors on health, that funding is getting cut. So unfortunately, the research, historically we know that your environment through epigenetics research level impacts one's health. But unfortunately, going forward, our ability to study that and to kind of create actionable insights is going to be limited because of lack of NIH funding to support that. We know recently with the expansion of data centers, there's one that's being built, I think it's in Tennessee. The issue is that it's producing a lot of methane gas that's causing harm to the neighboring community, that this big data center for Elon Musk's AI Gronk or whatever it's called, whatever his AI solution is, their data center is creating toxic fumes impacting the community. So we know it's causing environmental harm and causing community harm, but there's no regulatory effect actions to take because the government isn't really listening to the science or the historical information of how environmental factors impact long-term health outcomes. So it is we know the reality of it is just, does the government care enough to regulate it or to kind of punish people that are bad actors? That's all the safeguards that were previously in place are slowly peeling back, and we are having less regulation for some things. And so unfortunately, we are going to see more rates of illness across the country increase because of environmental factors, not because we don't know, it's just we're not looking to do anything because of the knowledge that we already have.
I thank you for that answer. We're really at the close here. I'm going to give each of you 30 seconds to have one last comment, request, plea, hopeful statement. But please, everyone who's listening to this, will you please reach out to us? We're going to be pulling together resources, vetting them with some of the best folks who are vaccine advocates and experts, and also dedicated to health equity. So please reach out to us. If you're a clinician, if you're a physician, nurse, pharmacist, a community leader, a policymaker, someone in industry, we want everybody to join us to make sure everything that we can assure the best outcome possible in this scary time. So I'm handing it over to our three guests here. And you know what, Daphne, I'm going to start with you since you're not on mute.
Okay, great. Thank you all very, very much. Thank you all, Dr. John, Dr. Tan, and Dr. Laura Lee Hall. Thank you for allowing me to be here with you all. I want you all to know that public health is not just an individual effort, but a collective effort. It takes a village. It really takes a village. Become informed. Read the science. Read the science, not TikTok, Facebook, Instagram, and whatever else is out there that's coming out of people's head and not out of evidence. Read the science. Talk to your neighbors. Talk to your family. Be an advocate for yourself and also for your community. Thank you.
Thank you. LJ, you want to say any last words?
Be very quick, 30 minutes. For all of you, to echo what Dr. Ferdinand says, stay engaged. I know it's hard. I'm so grateful for you all on the ground for doing everything you're doing to try to protect people of color and just people who are vulnerable in general, right? So thank you for that. Stay engaged. Don't give up. Stay engaged at every level you're at. If you're a provider, learn and offer the vaccines. If you are a community member, learn about the vaccine, speak to your fellow community members, tell them about why vaccinations are important. Just stay engaged.
Thank you so much. Donnie, you get the last word.
Awesome. Well, thank you so much for having me on the panel. I enjoyed being on the panel with all the panelists. And I think the most important thing to teach people is that science is evolving. I always give the example of the first airlines, the first plane by the Wright brothers compared to where we have right now. What happens in science is that we look at it being black and white. Whatever the literature said at this moment has to be true and we can't build upon it. But if you look at airlines, do you want to fly on the Wright brothers plane or do you want to fly on the current airlines, right? Because the technology evolved and evolution of our knowledge, that's what's leading to great discoveries, allowing us to travel to greater distances at faster speeds. And so what technologies like mRNA, that's just the evolution, as Dr. Tan mentioned, of things that have historically been done, but allowing us to get better. So we have to get people to understand that science is not black and white. We do need to have the room to learn and evolve from the research. And that's what discovery is all about. And it's a continual evolution. I did put in the chat some resources. There's a public health collaborative. They have a lot of great communication materials that you can use to help message within your community about vaccinations, whether it's for flu, measles, and things of that sort. But there's downloadable toolkits. Running a nonprofit, I love things that are free. It's a free resource, so have to share that. Also, I want to provide a link to a handout that my organization has put together just of where to find vaccines, because that's the hardest part. We're telling people to go get vaccinated, but they don't know where to go to know where they can receive it. And at the same time, how do you afford a vaccine? So on the handout, there's information about where you can look to find vaccines in your locality, and also potential ways to afford the cost, because sometimes it's cost prohibitive.
Thank you. We are at the end. We will be compiling all this, folks, and making it available. So I look forward to working with all of you, and I deeply thank our panelists. Thank you for your great work. Have a good weekend, everyone.
Stay strong. Thanks, everybody. This was thanks for the opportunity to work with you all.
Thank you.